We're the hydradenitis super divas. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The hydradenitis super divas. Put the shame to a halt, cause it's not your fault.
Hey guys, it's Brinley with the Hydradenitis Super Divas. Thank you for joining us for this episode of Season 2. Just a heads up, if you are watching on YouTube, you will not see any video of the hosts. Unfortunately, the recording was stuck on time-lapse, which is not super helpful. So we do have all of the video of the guest who was on Zoom. That's perfect. If you're not watching on YouTube, this has zero bearing on you at all. Everything will still run just as it should. So just a heads up that, again, we won't have any video of the host, but we hope you enjoy the episode. Thanks. Hi, everyone, and welcome to this episode of Hydradenitis Super Divas. Today, we are here to talk with Dr. Colleen Cotton, who is a pediatric dermatologist. She is at Children's National and also at George Washington University School of Medicine in DC. So if you have a kid and you're in that area, she is the one to go see. We're going to kind of just pick her brain today about pediatric HS, what that looks like, all of the burning questions that we have. So thank you so much, Dr. Cotton, for joining us today. We really appreciate it.
Thank you guys so much for having me.
Absolutely. So I know, Sid, you had a burning question.
Yes. I wanted to know, what is the earliest you're seeing HS in the peds cases in kids these days?
It's a good question. And I do think it's getting earlier and earlier that we're seeing it, because we do know that puberty is happening earlier and earlier, and we don't fully understand exactly why that's happening. But I think the youngest I've seen, she was referred to me when she was 9 years old because she had failed adalimumab already. And
wow.
she, I think, had symptoms for, I'm trying to remember how many before she got to me, but a couple of years before
Wow.
she came to see me. That's definitely not common. But just yesterday I saw a little boy who had his symptoms started when he was 10. So it definitely can be pretty young that we see it.
Are you finding more that you're seeing kids earlier now? Like, is it awareness that you think maybe bringing in people earlier? Do most people already know when they come in, like the parents that have some idea that their child might have HS? Or are they just like, there's something going on and here we are, we need help on figuring out what it is?
It really varies widely. I have some people who come in because there was a very astute person in the emergency room who figured out what this was and sent them to me. And the parents have no idea what it is. And I have some people where they had a family member who had it and they carried a diagnosis. And so when it started, they knew what was happening. And so they brought them in. But I'm surprised sometimes the ones who get sent to me who do have a family history, but they've never received a diagnosis and they've just been suffering with that for years and years and thought it was just normal.
Yeah.
Because when they talked to their mom said, well, everybody gets boils in their private area in their underarms, and it just happens sometimes, and you just have to kind of suck it up and deal with it. And it's not until it gets really, really bad in one particular person that they suddenly come to the doctor.
It makes me so happy when you just said that ER doctors referring. That, like, it makes my heart so happy because we know that's one of the main issues that we have is that, when people are visiting urgent care or ER, they're not looking at the chronicity in which this is happening, where it's like such an easy thing to refer to derm. If you're like, oh, this has happened to you before, okay, we should probably get you a referral to derm. So that makes me really happy. And that's something we're definitely working on trying to educate. And what do how do you explain it to parents? Or what if, let me put it this way. So how do you deal with it if, like, a parent does have HS and their child has HS? How do you approach that situation differently from, like, a parent who doesn't know, or do you kind of start at the very beginning with everybody?
I kind of start at the very beginning with everybody because I never know what they've been told before coming to see me. And I think even other physicians have told other family members or the patient things that may or may not be true, or maybe were once thought to be true, but we no longer think are true.
Mhm.
So I kind of try to preface my explanation always just sort of like, so what do you know? Tell me what you know. Tell me what you understand about this condition. And usually the answer is slim to nothing. Or they're like, I know it's boils in my skin folds. And that's it. That's all I know. So I'm able to kind of take what they do know and kind of split apart, what it is, what it isn't. And I kind of emphasize, I'm like, this is our current understanding of what's going on. There are so many different pieces that play into HS. And I personally believe that it's very individual and personal, which factors are most important for certain people, which is why I think we have such a hard time figuring out what medications work and what don't, because I think that there are subtypes of HS that we're trying to specify now, but we still don't do a very good job of that. And so I think there are some people where, certain medications were never going to do anything for that person because the piece of HS that it's targeting was never that important for that person, while it might be super important for another person. So I preface that with them to say, like, we're going to try to figure out what's the most important piece or pieces for you. And that may mean that we try some things that don't work, and that's okay. But we also have to make sure we're giving things enough time to see if they're going to work.
Yeah. I think that's one of the hardest parts, I think, about HS for both adults and for kids. And I'm sure it's even harder for the kids section, is that, giving something 3 months is a really long time sometimes, to be living in pain and to be dealing with that. Yeah. It's a really difficult time frame, and you're hoping it's going to work. But then it's like, if it doesn't, you've got 3 months more under your belt of something not working. So just to acknowledge that for people, it is a really long time, especially for kids. One of the other questions I was going to ask too is about like pain management for kids. I know that this is such a touchy subject. I have 2 daughters who have HS, 20-year-old stepdaughter, so she's not so much a kid anymore. And my 16-year-old, and we struggle with my 16-year-old and her pain control. And it's one of those things that I think you have to like make decisions as parents about how to handle that. But what do you recommend for pain control for kids? I mean, we can do everything we can to control the inflammation and the disease, but what about the pain piece of that?
It's really difficult, and particularly in kids, because there are some medications that I will try using in adults that are denied by a kid's insurance company because, well, you're not 18 yet, and this isn't approved in 18. So I can get like Tylenol and narcotics, and like there's not the whole broad range of what I would like to necessarily be able to do. And it's also hard because, parents, like you said, they have to decide how they're going to handle that. And sometimes that means taking a medicine that they might be a little bit afraid of the potential side effects of those medications. But I do have a lot of kids come to me and I ask them, what do you do when you have a really painful flare? And they're like, nothing. Like they don't even take ibuprofen, Tylenol, like nothing. Right. So for some people, that is a place to start, where we kind of talk about how, okay, these are the maximum doses of these over-the-counter medications that you can take. I find some people, it works to alternate ibuprofen, Tylenol. So you're taking something every 4 hours, but not like not the same thing. And then I have some people who are like, that does nothing for me, but if I take them both at the same time, then that can kind of like knock things out for a little while. So it really depends, but I think we need to do a better job, definitely, of addressing it. And I do feel very limited in what I can offer people because I know I'm not giving them the best options. We just don't have a lot.
Yeah, there really aren't a lot of options. I mean, it's a very, very limited toolkit, especially for pediatrics. So yeah, I mean, the hands are tied all around. One of the other questions, and sorry, you guys, jump in if you have questions. I'm just like, I'm always intrigued. I know one of the main issues that parents and kids have is like there's a difference of opinion, especially if you have a parent who does not have HS and you have a child who has HS. So I know for me, like benefiting that I don't know if I call it a benefit, but that I have HS. So I can understand that what may look like a mosquito bite size on my daughter could be extremely painful because of the pressure. So it doesn't have anything to do with the size of the abscess. Some of the smaller ones are more painful. Yeah, but you know that parents who are looking at that are like, give me a break. Like, come on, muscle
Or
up.
it's just a rash, or
Yeah.
like, yeah. it can be
And so
hard.
the child is experiencing completely different symptoms than the parent can really understand or grasp. And until they come and see someone like you, they wouldn't necessarily understand how painful that can actually be. So how do you deal with like allowing and helping the kids be advocates for themselves? And how do you work on kind of helping the parents understand the severity of the disease and potentially looking at, maybe a more like a biologic or something that may be a little bit more advanced when there's so much fear around that?
That's a really good multi-part question. I'm going to try to attack these different things. So first off, I actually find it interesting because I see both ends of the spectrum. I see what you're describing where the kids are telling their parents this is really painful, and their parents are like, it looks like nothing, like I don't see anything. On the flip side, I have kids who will not tell their parents, just won't tell them. And their parents are like, I only know they're having a flare when I notice that they can't put their arm down, or when I notice that they're walking funny and they didn't tell me that something was popping up. And it could be because the kid's trying to work through it. It could be because the kid like doesn't want to tell their parent because it's embarrassing. I see both ends of that. And both of them can be damaging to the patient as well as the family dynamic. So I really try to encourage communication between parents and kids. And I'm like, everybody's HS is a little bit different. And I do bring that up, especially when there's a parent with HS, because sometimes, actually often in my cases, the parent's HS is not as severe as the kid who's sitting in front of me. And so I have to kind of explain, you guys may not have the same experience, and that's normal and that's understandable. And it doesn't mean that there's anything that we're, doing wrong or that they're doing wrong. But it can be really challenging. And then when it comes to things like treatments and biologics, I literally ran into this yesterday. I was talking to a patient. I was like, look, we've got several options here. What do you want to do? And mom chimed in with what she felt she wanted to do, and then did something which I really appreciate, which is, that's how I feel about it, but this is her choice. So she gets to decide. So she turned to the patient and was like, you know what I think. Now, what do you want to do? And she wanted to do something different than what her mom wanted to do. And luckily, thankfully, her mom was fully supportive of that and was like, are you sure? And she was like, yes, I would rather do this. And she's like, okay, then let's do that. That's not what I would pick, but okay. And sometimes it's not that easy. And sometimes I have to remind parents, like, this is their body. And, if they don't want a Kenalog injection, for example, that's their prerogative. Like, I'm not going to hold them down and force a needle into one of their nodules. Like, that's up to them. Even if we know it might make them feel better, if they don't want to do it, I will ask every time, but it's their choice every time.
Yeah. And I think that's a really empowering your children to make or to be part of that decision-making process is such an important thing. And we do the same thing with my daughter. It's your body. You're the one living with your HS. So I can't tell you what the best thing to do is because I don't know. It could, who knows if it could work or not, but you're the one who has to, stick with the treatment regimen, and you're the one who has to make this decision. And it informing them of what all of the parts are about that is it's a powerful thing. It also helps them, I think, in later in life, learn how to advocate for themselves and to be in charge of that care for themselves too. So I'm super happy to hear that experience happened, because I think there's a lot of fear that comes around the treatments, especially because there aren't a ton of FDA. Well, we have one FDA approved treatment. And even the off-label treatments, it's like, I notice a lot of parents have different feelings about like birth control even as an option, because they just associate that with like giving the green light for their child to have sex. And it's like, no, this is like taking a medication. You know, it has nothing to do with like sexual experience or anything like that. This may help your 12-year-old with their flares. And so it's hard, I think, sometimes to separate that for parents because there's such an emotional attachment to that. Do you have experience in dealing with that and walking through that with parents?
Oh yeah, all the time, all the time. So we not only do we have run into this for HS, but we use oral contraceptive pills for acne as well very frequently. It's actually an FDA approved indication for certain types of birth control that to treat as primary indication acne. And I do run into a lot of fear and a lot of just like emotions tied up in that. And that could just be because, as you said, they view it as a green light of being like, well, now you're on birth control. I'm never going to know when you start having sex. But also there are a lot of people who have some misconceptions and misunderstandings about what birth control does and does not do. And it's not, I don't always have time to necessarily delve really deep into what those beliefs are, and they don't always want to talk about them with me. I
think it makes
definitely
it
have
uncomfortable. It makes them uncomfortable. You know, they're like, I don't want to be talking about this. I don't want my kid to be talking about this. Now they probably weren't even thinking about it, and now you're trying to just get them all. Yeah,
And you're like,
I think
I'm
it just
trying to
makes
get
it
them
a
to
comfort thing.
take.
they'll just put their foot down and be like, we're not doing birth control. And I'm
Yeah.
like, sometimes I will explore that. And sometimes I'll be like, okay, let's move on.
Yeah, she's like, not my battle to fight.
It's like, sounds
kids
good.
started.
All
Yeah.
right. But especially in patients who I've had this happen several times where the patient might have polycystic ovarian syndrome. They have irregular menstrual periods, and their mother experienced the same thing and was put on birth control for their irregular periods. Then when they came off birth control, they had a very difficult time getting pregnant because of their polycystic ovarian syndrome. But they view it as, because I was on the birth control, I had a hard time getting pregnant. It impacted my ability to get pregnant. So they don't want their children on it because they worry it's going to affect their ability to get pregnant, when in reality, it's the condition that the medication was treating is what makes that difficult. But it's really hard to have that conversation, especially when someone has believed that for 25 years of their life, that like birth control did this to me. It's very hard to have a conversation and say, I think it's possible that it might not have been, that it may have been the reason you were having irregular periods in the first place. So that can be really tricky. The flip side of this though with pediatrics is kids don't always understand everything I'm saying, like especially the younger ones. Like I want you to be involved in the decision, but if you're 12, 13, 14, you may not fully be understanding this risk benefit conversation that we're having. And especially a special population that we take care of are patients with Down syndrome. And there's a very broad range of developmental capabilities amongst those patients. So a 14-year-old with Down syndrome could be completely nonverbal and not be able to participate in that conversation, or they might be able to participate fully in that conversation and have an opinion on what's going on. So the age doesn't really help you there either. So that also adds a tricky piece to it, where we're trying to decide what's best for the kid and get them on board as much as we can, even if they may not fully understand what the risks and benefits are.
How do you explain to a child who, let's say, is the rare occasion, like a 9 or 10-year-old, what HS even is? Like, what would be your explanation? Because even as an adult, it's incredibly hard to understand.
So I don't know that I do the best job, but the way that I try is I say it's really important for me, first off, that you know what this is not. So this is not an infection. This is not because you're not taking good care of yourself. This is not because you're not cleaning well enough. This is not contagious. This is not because of anything that you did or didn't do. what it is complicated. Basically, your immune system overreacting to some irritation or something else going on in one of the hair follicles in one of your skin folds. And sometimes I have to explain what a hair follicle is. I'm like, that little hole that your hair comes peeking out of, that's called a hair follicle. And we have them all over our bodies. And sometimes there's hairs we can see in them, and sometimes there's very skinny hairs that we can't see in them, but they all have hairs in them. And I'm like, sometimes it's because your immune system is doing too good of a job. It's overreacting and working when we don't want it to. Sometimes there's an imbalance in the healthy bacteria that lives on everybody's skin. Sometimes hormones play a big role in it. Sometimes the way our body processes sugar plays a big role in it. Sometimes the way that our skin rubs together is a really big role. Sometimes weight can play into it, which is not to say, and I always go like on my little side note, I'm like, which is not to say that if you were not the weight that you are, that you wouldn't have HS. That's not the case. And I'm like, but, for a lot of different health reasons, we want to make sure that maintaining a healthy weight and staying active, which is easier said than done when you have painful spots in your skin folds, that's what we're trying to do, is calm down that inflammation. And so what we need to figure out is which pieces are most important for you. And I also tell them, if you go home and you Google this, you're going to see some potentially really scary looking pictures. This is not a guarantee that that's what's going to happen to you. My job is to try to prevent that from happening to you. So, and sometimes, a lot of times they come to me, they already have sinus tracts. They already have a good amount of scarring, because it can happen very quickly. And so I discuss with them, I'm like, at some point, we might do a procedure to help remove some of that scar tissue or those little tunnels that have formed under the skin, but we're not there right now. We're going to try to get the inflammation under control. Then we can talk about fixing those scars that are still causing you problems.
For children, is there a big overlap with maybe having severe acne and HS around that age, or are they usually completely separate?
I think they're usually completely separate. They definitely can run together. And I do have patients, I'm actually asking more among my severe acne patients, because they don't necessarily bring it up. They come in, I look at their face, their chest, their back, they have horrible nodular cystic acne. We're like, okay, we're going to treat this. We're going to do antibiotics. We're going to do Accutane, we're going to do something. But I'm asking them, do you get these spots anywhere else on your body? Do you get them in your armpits? And they don't mention it because they're like, well, it's acne. It's all acne and you're treating it. So why does it matter? But I'm having that conversation more, which is, I'm going to do this and we're going to treat your acne. It might not treat what's going on in your armpits or in your groin. That could be a different condition, but we're going to keep an eye on it and kind of come back to that at the end of your treatment course and sort of reassess, because sometimes it does beautifully for their acne, but it doesn't touch their HS.
Yeah. Can you have acne in those areas, under your armpit? Or would that? No, you cannot.
So acne, what we traditionally think of as acne is face, chest, and back, sometimes upper shoulders. Anywhere outside of there, you're really thinking about a different pathophysiology, a different condition.
Okay, that's really good to know, because I always try to tell my comments when people I'm seeing that going viral, but I'm always I don't want to cross the line too. Maybe it's just acne. I don't know, but that's good to know. Okay.
And are you finding a lot of people that are saying yes, that they're having issues when you're asking that question, about when you're looking at their acne and then asking them if they have any issues in their armpits or groin? Are you finding a lot of people that are? Or?
More than I expected. It's not everybody, and there's still a decent proportion of people who don't, but it's more than I expected. And I think I don't just think that I'm finding all these patients because I'm interested in HS and so I'm asking about it, though that is definitely part of it, but it's happening more and more. And my residents, my trainee doctors, when they work with me, they kind of make fun of me a little bit for this. It's happening more and more where I've got my hand on the door. I've been like, okay, great. It's been so nice to meet you. We're going to follow you up in a few months. And they're like, actually, there's one more thing. Could we maybe talk to you about? She gets these bumps in her groin. And I'm like, okay, well, let's take a look. And they just make fun of me because I'm like, I didn't even ask about it, and it finds me. It comes to
That's
find me.
good. That's so good. That means you're genuinely making change. And we honestly heard that in an episode before where they were saying that they just added the questions, kind of like a pre-screening on, on the form that you go fill out. Everybody fills out forms when they go to the doctor, right? And just asking, like, do you get, bumps or boils under your underarms, and just asking the question. He was also amazed by the feedback that he was getting.
Yeah, it was Dr.
So
Resnick.
yeah, that's so cool. I do have a question though. What's the difference to you between acne on your face and HS on your face? Because I feel like I do have cystic acne, if I'm being for real, but I also feel like there's like holes in. So I'm like, I feel like that's HS, and it's just kind of like now getting mixed up. Is that possible?
I'm so sorry. Your microphone cut out for a second while you were asking that question.
Oh, oh. Can you hear me now?
Like, I can hear you now, but I missed like the
I
middle.
can like
part of
barely
it.
hear myself. Can you guys hear me?
I hear you perfectly, yeah.
Sorry.
But she was just basically asking about like the overlap between acne and HS on your face. I think me and her both have acne, and we've kind of been more probably open to questioning the fact that it could be HS or acne.
I mean, I feel like it's definitely been HS, like the way it has formed, the ones that turn into holes. You know what I mean? Like it was inflammation. It was more than just like a pimple that you feel like it's a blackhead or a whitehead. It was like deep. So I just don't know, like in the peds cases, if she's seeing that and what the difference is. Like, how do you know the difference?
It's a good question. I don't see it that often in the pediatric cases, but I definitely have seen a handful of patients where I'm like, if you took that and you put it in an armpit, I'd call it HS. Like I think you can have both. I think it's uncommon, but you can definitely have sort of like an HS type reaction on the face, and it can sometimes scar like HS can. And I have seen that. Behind the ears is also an area that like don't check that often, but definitely happens and can be a really tough area for some people.
It's the worst. I also have it behind my ears. So crazy. Just like areas you feel like you can't talk about it because nobody else is talking about it. But I'm like, I get it though. I get it really bad behind my ears, and it smells disgusting. Like when it pops, it gets so crazy. And it's not an area you would even think. And I blamed it on hair products for a long time.
Yeah. Caitlin has one, I think, on the lobe right now too. And I was just like, oh, I'm sorry. It sucks. What do you recommend like for parents? I know as a parent, right? And knowing HS, I have a different perspective on it than parents who don't. But I think one of the things we see even with adult HS is that people learn that of their diagnosis, and then they come home and they're like, okay, we're starting fresh. We're changing everything about our lifestyle. We're clearing out all of the cupboards, all of the pantry. You're not going to eat anything you've eaten before. And like we do this 180 because you're trying everything that you can to make your child not be in pain. But at the same time, you have no idea if any of those things are actually contributing to their HS. Too much change causes stress on kids, which we know that stress is a huge catalyst to flares. Like what advice do you give parents about like how to do this in a measured way as opposed to just like we're changing everything?
Yeah, it's tough because I also want to tell them like, we're gonna do some things that would not be sustainable if you did them forever. We're not gonna do this forever. Like all the medications they're taking, I'm like, I'm not going to ask you to take 4 pills forever, every single day. Like we're going to try to, wean it down to the smallest number. But in terms of lifestyle changes, I think it can be hard. And I don't always have that conversation with people. And maybe I should start is that, we don't want to, Rome wasn't built in a day. Like we can't do all of these things and stick with them. When I'm having that conversation in terms of like, how do we sort of make a change? I'm like, pick one thing, pick a little thing, might not seem like that big of a deal, but just focus on that thing for about 2 or 3 weeks. That's how long it takes to build a habit. And then you can build another one on top of it. Or I try to get them to like link something with something they're already doing.
Back habits.
Yeah.
Atomic Habits. Recommend that to all the parents. It's such a good book. But that's what you're reminding me of. It's like you have to kind of like convince your brain that you're doing something that you already normally do. Like, how about journal about how you feel today, about how your HS was every day after you brush your teeth, you know? And I think people think journaling has to be like you're writing a novel, but it could just be one sentence of how I woke up feeling this morning, or do I have any active flares? And I hate journaling sometimes too, but I'm like, if I stack the habit with something that I'm already doing every day, especially for kids because they thrive on routine, I think that would be so beneficial for them.
Yes, it's phenomenal. And sometimes it's hard when I'm trying to find something that's routine in their lives and I'm coming up empty. But I have a
Help me
kid where
out
I'm
here.
like, do
You're like,
brush-
you eat snacks every day? Stack it with that habit.
Stack it with your Takis. Like,
Yeah.
But I'm very fortunate in my multidisciplinary clinic, which we've recently started. It's myself and a psychologist, and a pediatrician who specializes in obesity medicine. So she does a lot of our hormonal things. She does a lot of our metabolic management. And so she's able to take the time to sort of counsel a little bit more on what realistic steps and changes are to be able to improve diet, nutrition, and things like that. We're working on getting an actual nutritionist who can be part of the clinic for those patients who are really interested in that. And not everybody is, and that's okay. But our psychologist also works with kids on like ways to maximize their adherence to things and ways to not burn out and trying to build a habit, which is great because that's what they're good at. And they can spend the time going over that with people while I can be working on the medical management for other people. And it's been a really great system.
That was the next question I was going to ask, was about like the mental health and well-being of kids, and like how do you approach that in an office setting with them? Like, do you tell them to make sure that they're keeping check-in on it, or what is your approach for that?
So it can be difficult because I mean, like, there's so much to talk about with HS, right? And I have a
Yes.
15-minute slot. Sometimes a double booked 15-minute slot. So I want to give people as much time as they need, but I can't always do that. So sometimes that looks different. Sometimes I just spend the 45 minutes with the person and then we like figure it out later. Sometimes I tell them there are pieces of this that we're going to talk more about at your follow-up visits. And I might bring them back for a sooner follow-up than I normally would so that we can have discussions of those other pieces of it. And sometimes if we're really running behind already, I'm like, look, this is a long conversation. I'm going to set up a video visit with you for like, later this week or next week. And then we can sit down and we can have as much time as we need to go through this because it's a lot. And I want to make sure that you have the opportunity to ask all of the questions that you want to. And it kind of sucks because yes, it's another doctor's visit that you have to, work your schedule around. But I do think people appreciate it because there's nothing worse than when your doctor's running like an hour behind, and like we don't like it either. We don't like
Right.
Yeah, of
people
course.
wait. So, but I want to make sure people have time to talk about it. And so I will ask people, we are fortunate in that when we bring kids in, part of our screening is that they get asked 2 questions about their mental health. Like, have you had thoughts about hurting yourself? And I forget what the other one is, but I think it's like in the last 2 weeks, have you felt down, sad, or depressed like most of the days or something like that? And if they say yes to either of those questions, then it kind of opens up more questions that our medical assistants will ask. And then I have that information going into the room. And if I get a sense, if the parent brings it up or if the child brings it up, if I get a sense they need a little bit of help, and a lot of people are already seeing a therapist or a psychiatrist or trying to get in to see a therapist or a psychiatrist. That is the advantage to having my psychologist that we work with, is that I can set them up with an appointment for her, even if it's just for her to kind of get a sense of what they need and point them in the direction of the right resources. Because we know that depression and anxiety are more common in patients with HS, even just outside of feeling depressed or anxious about your HS and about your symptoms. So sometimes it is just about like, if we can get the disease under control, your mood is going to be great. And sometimes it is, we can get the disease under control, but you still have some depression or anxiety that might benefit from therapy, cognitive behavioral therapy, or, medication, or both. And that's a conversation that I think you should have with somebody else who's qualified to do that. And most of the time people are receptive to that idea that this is a really tough condition to have. And I'm like, I would really love for you to see our psychologist so that we can talk about, what has the most impact on your life. And the pain management is a huge one. And so she does a little bit. We actually have some psychologists with our pain management team. And so occasionally I will have patients go talk to them specifically. But it's a really big part, and we may not always be something we get to on that very first visit, especially if people don't bring it up. But certainly by the second or third visit, I try to have that conversation with people.
Do you tell people not to go use Dr. Google's?
I don't, because I'm like, I know you're going to. So I'd rather help guide you in like what you might see when you go do this, like to kind of give you a sense. And I preface it by saying like, there's a lot of information out there. And so I have a little sheet, I have a little handout that I will give people sometimes that has HS Connect, the HS Foundation, Hope for HS, like on it. And I'm like, these are good places to go to get information that you can feel a little bit more confident in, how true and accurate it is. And I was like, something that was posted 3 years ago may or may not still be totally 100% accurate, but it's fine. It's at least a place for us to start, because this is, it's exciting that, and though it makes it tricky that it is changing so much. Our understanding is evolving very quickly. And I like that, but it also makes it really difficult to find things online that are accurate.
Yeah. Talk about 3 years. Let's talk about 30 years. Some of the stuff is still coming back up from then. And it's like, whoa, wait a minute. I'd be happy if the 3-year-old information was being, sent around. The other question I had too was, parents that have HS tend to always be on the lookout for signs of HS on their children. So one of the things I know with Caitlin is I decided I'm not going to, I know she has a higher risk of having HS than other kids that don't have parents with HS, but I'm not going to like rob her or myself of her childhood by being hyper fixated on it. Because I think, sometimes any bump, anything can potentially like trigger a parent to think that their child has HS. And I know it's becoming more commonplace to talk about, and part of that is because we're doing things like this so that people don't have to carry that shame. But encouraging kids to talk to their parents about it. I know, like you had mentioned, some kids are just like, I'm not talking to freaking anybody about this, including my parent. And that's really hard, because as a parent, then you start to over ask questions. And I think it can create boundaries in your relationship with your child, because they don't want to be asked about it constantly. But then as a parent, you're like, well, I got to ask you because you're not just freely telling me. So like, do you have any advice for parents and kids when it comes to that situation?
I wish I did. I wish I did. Because it's hard. I don't get the kids until they have HS. So I can't really talk to them about it beforehand, which is why I love things like this, because if someone comes across it, then they know they can talk about it. But I do sometimes have parents who are a little bit too up in their kids' business. And I remember one mom in particular. And the thing is, like, you're trying to help your kid, you're trying to do the best thing for them. But she was like, if I'm not on top of her, she's not taking her 3 times daily showers. And I'm like, whoa. Back up a second. Like, what do you mean? What do you mean you're having her shower 3 times a day? And she's like, if she showers 3 times a day, then she doesn't have as bad of flares. And I'm like, okay, but is she living? Like, I gotta have a balance there. Like, we could do other things that don't involve that, and so I kind of try to have conversations like that, where it's like, we have to do stuff that works with your life and that doesn't completely take over your life or your parents' life.
Oh, showering 3 times a day.
yeah.
Gosh, she's tripping.
Yeah.
Okay, but everything I did that. And my mom was opposite. She was always concerned because I would shower in the morning to go to school. And then I would come home and shower before I had to go to practice. And then I would also shower before bed. And she was like, dude, you're doing too much. But like, I wasn't telling her how active my flares were and how I felt sweat was making it worse, having hyperhidrosis and HS. I've always sweat so much. So it's always made me feel extra dirty, even though a huge part of HS is making sure like it's not because you're dirty. But I'm like, I'm literally sweating through my whole body. You know what I mean? So my mom was always overly concerned, like, you're doing way too much.
Yeah.
And that's hard with the hyperhidrosis piece of it.
Yeah.
Yeah, definitely. And we actually just did an internal survey on that. And it was fascinating because it definitely, we think we had almost 100 people respond. And it definitely looks like there may be some link between hyperhidrosis and HS just based on the number of responses we got. So we're going to delve deeper into that too, because I think, even through just hearing Sydney's journey with that, it's like, okay, well, that might make sense. Maybe there's something there that kind of correlates. So I was going to say too, just as a parent, a couple of the things that I always do, like for my child and that I found that work is like for physical education. She's in high school now, but even in junior high, we just had a note from the derm that said that she didn't need to participate unless she felt she was physically able to. So it was completely up to her and her discretion as to whether she could do PE based on how she felt that day. I thought the kid was never going to do a damn day of PE, but she actually only used the note twice. So I was very shocked by that because it also, I felt like gave her, she was in charge of that. And I think when you have a child with a chronic illness, you have to have a higher sense of trust with your kid because you're relying on them to tell you and help you understand what's going on with them.
Mm-hmm.
The other thing we do is we call them owies in our house. Instead of abscesses or lesions or flares or nodules, because all of those things are so sterile. And the word owie comes with like a sense of compassion, and empathy. And so it also, I feel like, makes it easier to talk about because it's not so like I have a nodule. It's like I have an owie or I'm having pain. I'm experiencing pain. I have a flare or something like that. So it seems to have just kind of like softened it a little bit and makes it more conversational instead of everything being so like matter of fact. So just to pass, a couple of ideas on to other parents. And, if you need a 504 plan for your child, my daughter can't be in school all day because the chairs are hard. Now, I'm the mom who said, well, why don't you get one of those backpacks that has wheels on it? And she was like, over my dead body. Like, I'm not doing that. And I can't believe you even mentioned that. And then I also said, like, we'll just take a butt pillow. And then, I mean, I was partially kidding because I knew she would never do that. She didn't take the backpack idea. But these are things that, like, when you're having flares in your groin, if we're at work, we have the opportunity to get up and like walk around or get a butt pillow and sit on and not have to be necessarily embarrassed by it. But at 16 years old in high school, there's no way that child is doing that. So for instance, we started doing, she's half online and half in person. So she does get some of that socialization at school, but she also can't be in the classroom for that many, they were sitting on stools in science. She's like, I can't do this. And then they also don't want to be the odd person out either. The only
like
person
every time, odd person out of gym, odd person in the science class, odd person, it could just be so like, I'm that girl in a weird way. And as much as we are like, no, you're not, kids just have this way of like just having a little bit of little mean people energy.
So just, it's already hard to be a teenager. And then when you put HS on top of that, I mean, it's doubly hard to be a teenager with HS. So, parents, just keep that in mind too. Like, empathize with your kid. I let her make the decisions about whether she can go to school and sit all day. Carrying a backpack can be extremely painful when you have armpit flares. I mean, these are things that are not taken into consideration. If you don't have HS, you would have no idea. So those kinds of things are important to keep in mind. And it may be something that you can open up that discussion with them by asking, like, hey, you look to have, like, it seems like your armpit's bothering you. Is like carrying your backpack going to be okay? Like, maybe asking more questions of them, kind of letting them know like, hey, I know, but not, I'm trying to be all up in your business, is really helpful. And I really feel for parents who have that kind of relationship with their kid where their kid doesn't want them to know. And I think explaining to them too that huge part of that is the shame that we carry with this disease, that it's incredibly embarrassing. And it doesn't matter if it's your mom. I was like not telling my mom as an adult that I was having issues until I could not deal with it anymore. So it's really important to just keep those things in mind as a parent too, that what they're going through is devastating for them in a lot of cases. And they're going to have to learn how to manage this for the rest of their lives in one way or another. And so, helping them and checking in on their mental health and kind of keeping tabs on them, I think is super important too, because as a parent, you're first and foremost. So just asking them how they're feeling or what's going on. And I always encourage everybody that has HS to see a therapist. I don't care how old you are. I think all of us need it. So just wanted to drop a few hints there, like ask your derm for a note for PE, give it to the school. If you need a 504 plan, get a 504 plan. Your derm can work with you on that too, on filling out the paperwork that's needed for that so that your child can get the help and that they need.
And I love all of those ideas. And, your dermatologist may have never filled out a 504 plan before. I know I didn't before I started, seeing patients in pediatric dermatology. We see kids, we see people in school. Adult dermatologists don't necessarily think about that as much. So don't feel bad if you have to explain to them what it is, and just feel like it's not that big of a deal from the physician side of things, but having some ideas on things you can do. Another one that I had a girl was there was an elevator in her school. And so she had permission to take the elevator when she was having a flare instead of having to climb up and down the stairs. She had access to a microwave because she was never sure whether or not she could eat the food that was, available for lunch. So she could bring her healthy food that she knew wouldn't flare her up from home. She could reheat it in the microwave. So like, those are some other, like, it can be anything. You can ask for it. And then one thing that you said, Brinley, is really tough and is a big sticking point for a lot of people, which is, you said, for the rest of your life, you're going to be dealing with this. And it is very hard to have that conversation, both with a patient and with a parent, to say you have a chronic condition that is not just going to go away.
Mm-hmm.
And I do have kids who come to see me who've had it for 2 or 3 years. And I'm the first person who really had a conversation where they were like, wait, so this isn't going to go away? Like, this isn't something that she just has to get through and then it's going to be gone. Like, this isn't going away. And that can be really, really tough to swallow and deal with. And again, I agree with you. I think everybody, regardless of whether you have HS or not, should see a therapist at some point. But definitely, having a chronic condition can be very hard to adjust to.
Yes. Yeah. And it doesn't mean that it won't be well managed at some point, and it may be well managed for the rest of your life, but it will still be a part of your daily in some way, shape, or form. And yeah, it's definitely hard to say that to somebody at 10. And first of all, they can't even see past today, let alone to the rest of their lives. And parents are going to be like crushed by that information, because they don't want their kids to suffer. But the other tip that I forgot to mention too is like our kids have specific amount of bathroom breaks they can take. And so in our note, she also has unlimited amount of bathroom breaks and whenever she needs to, because if you have an abscess that's draining, you're not going to hold your hand up and wait for permission. So she doesn't have to have permission. She can just get up and go. And it's just those little tiny things that help your kid feel like you have their back and you're on their side and you're advocating for them. And a lot of times, like I said, I was really surprised at how often she didn't use the things that she had been given, but it made her feel so much better knowing that that was there for her.
It wasn't an added stress of anxiety for her,
Yeah.
Because to be like, oh my gosh, I cannot go to the bathroom for another 55 minutes, but you're draining right now, it was like anxiety.
Yeah. Yeah. So trying to do whatever we can as parents to help our kids through this process is so important. It's crazy. Thank you so much for being on with us today. I can't tell you how much I appreciate it. You know how I feel about pediatrics. I'm a huge fan of you, huge fan of all of the Peds Derms who are taking a special interest in HS. And I think it's so necessary, and it's amazing what's coming down the pipeline, and hopefully we'll be able to do more clinical trials with peds as we get going through this and find better treatment options that will help so that kids don't have to go through what all of us have had to go through on a repeated basis, and we'll be able to get them some help sooner rather than later. So thank you again. I
Yes,
really
thank
appreciate
you.
it. It's been amazing.
Absolutely. Thank you guys for having me. This was awesome.
Yeah. So if you are in the DC area, Colleen Cotton, Children's National Hospital and George Washington School of Medicine, she's who you're going to want to go see there, and her team at the Multidisciplinary Center. And thank you for joining us on this episode of Hidradenitis Suppurativas. And don't forget to like and subscribe so you don't miss the next one. And thank you so much to Insight for sponsoring this episode. Bye, guys.
Bye.
Thank you, Dr.
Thank
Cotton.
you.
You're welcome. Thanks, guys.
That was
fun.
awesome. I
Yes,
know.
you're so sweet.
We're going to be
Yeah.
doing more. We got 4 seasons
I
sponsored.
love that. That's so exciting.
Yeah, so we're
Yes.
doing our second one right now, and then in January or February we're going to do our third, and then our 4th after that. So I'm very excited. Yes.
Awesome.
Yes. Thank you.
So
This is
have
good
a
too,
great
because then
day.
I can share these podcasts with my family members who are like, what is it that you do? Exactly.
Yeah.
What's that thing that you do?
Yes, and it'll be good to have a place where parents can go and listen to it too, like catching some of that info. And I did talk to Hope for HS about doing a parent support group and a teen support group. So I
Awesome.
think they were trying to figure out how to do that. And I said, I would be happy to moderate them. I just don't have the bandwidth to set them up. And like, that's their gig. So I had talked to Athena about doing that. So that would be super.
I
and
have
very
people
needed.
to refer when that
Yes.
gets up and going.
I know. I was going to talk to her again about it at SHSA and just ask her if they were making any progress on it. So,
Awesome.
all right. Enjoy
Thank
the
you
rest
so
of your
much.
day.
Bye.
Thank you.
We're the Hidradenitis Suppurativas. If you've got HS, you'll want to meet us. It's not your fault. Put the shame to a halt. HS divas know how to have a ball. The Hidradenitis Suppurativas. Put the shame to a halt.